Welcome to the 6th episode of our Therapy Insights Resource Roadmap Show. Today, we're going to talk about some of the resources in our Access Pass library in different ways. If you're already subscribed to Access Pass and you have the printables feature included, you have instant access to everything that we're talking about today. And if you don't, you can easily sign up at our website at therapyinsights.com. If you're listening to this episode on a podcast or watching on YouTube and you want official CEU credit, go to therapyinsights.com, go to CEUs, and then find the form for Pediatric SLP Resource Roadmap Show episode number 6 to get your certificate of completion. I'm your host, Bailey, and we have our writers, Tasanya and Heidi, with us today, and Megan is behind the scenes pulling up our resources to display. So I need to verbalize our disclosures since we offer the show for CEU credit. We're talking about Therapy Insights products today, and we're also all getting paid by Therapy Insights to run the show. So we have a great collection of resources this month, lots of variety. We're going to be talking about phonology, articulation, bilingualism, grammar, and even pulmonary conditions. So let's get started. All right, the first resource we have is Spanish Language Phonological Inventory Card Set. And Heidi, you created this resource. Can you tell us about this?
Sure. So we have another resource in our library that's for English with these phonological inventory cards. And they were really quite popular. So I thought, let's do this for Spanish, which you wish you could do it for all the languages, but we started here. So it starts off and it gives you like the IPA, the International Phonetic Library, sort of like it tells you which sounds are where in the Spanish language. So that helped. I don't speak Spanish, so I didn't know a lot of the stuff. I was creating this resource. So I found it actually really helpful to just have this cheat sheet almost to know how to make certain sounds. Like I know in my head, I've heard, and actually through the course of making this, I started to feel a lot more comfortable understanding how to pronounce certain words and then thinking about how I am a monolingual therapist, but there are situations you end up in where there is literally no other option. So this is a nice, hopefully resource for people to use. So it has that little table with all the different sounds. And then it's really nice at the bottom. It has some other websites to explore. So like Portland State University was frequently cited as I was researching for this article, for this resource, and they just have a wealth of information. They have stuff in other languages other than Spanish as well. So that was a great starting point for me. So we just put those there. And then these cue cards in community language that is produced by Eastern Health. And then we also wanted to shout out and list some other Instagram accounts you can follow that are bilingually focused. So there's about 6 right there that if you follow, that's what I do. I follow them and that's where I get ideas or think about. They also have some of their own resources that we would encourage you to seek out if that is what you needed for your therapy services to provide your services. So then the other part of this resource is 3 pages, and there are these and you fold the cards so that you can use them where the child can either just be looking at the picture and name them, or you can be talking about the sound. So we used the phonetic library from Spanish, and then the words are written there, and you can kind of use those to practice. And even if you don't speak Spanish, you're able to maybe get some buy-in or access to the language using these. So, I don't want to go through and pronounce them all, but there's all of our sounds, and it kind of tells you how to pronounce them. So this was definitely a leap of I think this is something our field needs more of. Am I the best person always to make it? No. So we tried to pull in other therapists to chime in to help us make this, but hopefully it's the start of being able to build out more of these type of resources because it's so needed. And I think something is important with this activity and this set is it can at least offer you a starting point to understanding, do they actually have a phonological issue, or is it a language they haven't acquired these things in English? And so we don't want to penalize a student or a child that can't do it in their second language if they're able to do it in their first. So sort of kind of my other reasoning for building out something like this, because you should be able to use these for quick stimulability probes and to figure out, can they make the sound just like you would want to know in English? And then maybe that's a nice place to start. So yeah, they're really pretty little cards. And like I said, we had a lot of buy-in with the ones we made for English. So kind of jumping out here and seeing if we can get some buy-in in a second language. So oh, you're still muted.
Sorry, I'm just talking away. I was just gonna say, I love this resource and like maybe could possibly even be used like as part of an evaluation, maybe like formally. So it's very versatile in that way, and the images are beautiful. I was also gonna say it might be a nice segue into our research article, if we want to move on to that. So this is a great topic, y'all. The title is Phonological Acquisition in Bilingual Spanish English Speaking Children. So this study was done in 2010. So the main takeaways from the article are that bilingual learners demonstrate some separation between their two phonological systems, but those systems do interact to aid in the rate of acquisition. Most bilingual children were less accurate in their speech sound productions in comparison to their monolingual peers. However, their skills still fell within the normal range for their age. Super important. In this study, bilingual and monolingual learners showed very similar rates of acquisition of phonetic inventories. Researchers did not find a correlation between high sound frequency in each language and more early or accurate acquisition of those sounds. Overall, bilingual language learning did not negatively impact speech sound acquisition in young children in the study. So I think this is just really great information. And just kind of quickly, the study looked at speech sound production between monolingual speakers and bilingual learners. I think there were 8 of each group. So a smaller study. And of course, they said, more research is needed with a larger sample size, but it did find some really great info. I also found it really interesting from this study. So it says results of the analysis on consonant inventory showed that all bilingual children demonstrated typical acquisition for their chronological age. And then similar to their peers who are monolingual, later developing sounds were not accurately produced. So a lot of similarities and parallels there, comparing the two. And then I think this is a nice time to bring up I would love to hear, Tasania and Heidi, your thoughts on this too. So historically, there seems to be some SLPs out there who tell families who come into evaluations and therapy who are bilingual or multilingual, that bilingualism causes a language delay. And not only is that just inaccurate, I think we can all agree it's inherently racist, and it's rooted in white supremacy, and it's also just unfounded. It's not evidence-based. It directly contradicts what was found in this research article and many other research articles too. And it's just inaccurate. And I also find that just kind of go against our code of ethics, and it just seems unethical. And just, I feel like the only reason that a therapist would tell a family that is that English and whiteness is superior or better, and that seems to say that it's better than their culture and their background. And I think another thing I thought about was just like how that makes that family feel in that moment. Like, what if one of the parents or caregivers or family members doesn't speak English? Like, so what are they supposed to do? Just not, communicate with the child. And I've been told by coworkers and therapists before a few times that the child should pick a language, just pick one, which just felt completely wrong to me in all levels. And then just again, directly contradicting what research has shown us. And it also isn't a demonstration of like family or child-centered care. So anyway, I wanted to hear y'all's thoughts on that.
So it's so interesting because I was listening to Heidi, and then I was looking at this piece, and I was thinking about some of the families that I work with as a multilingual clinician. And I work with families who are Spanish speaking, Creole speaking, French speaking, and American Sign Language. And more often I hear it with, for ASL, it's a whole different perspective, but with Creole speakers and Spanish speakers, many of these children, their families are instructed to pick a language, like you said. Or they're told that if they don't speak English only with their child, and that's the language they're told to pick. If they don't speak or use English only with their child, then the child's gonna have significant delays, they're gonna do poorly academically, And we know from research that this is not true, and more research is being done now because people are becoming more aware of the fact that it makes no sense and that it's culturally insensitive. And research is showing that these children actually succeed. It actually helps them to succeed to use both languages. And what we also know is that they actually do acquire a good receptive, they require receptive skills in both languages. They may not English as they may have in their primary language or secondary language. But as they grow older, they develop it more, right? So they have a good amount of receptive skills in, I'll use Spanish, for example, and they'll have the other half in English. And as they grow, they develop that children have to pick a language. And, you know, you may think that it's something that SLPs are not doing as often now because ASHA is pushing this whole cultural competence thing, but it still is occurring. And what's dangerous about it is that children are not only losing their language, they're also not just losing important aspects of their culture, but they're not able to maintain that bond between them and family members who only speak their other language. So we do have to get into the habit of not doing that. For people who, a lot of these parents who are sometimes they migrate or they immigrate to the country, they already come with an idea of one of their children to acclimate into the culture better. So it's very dangerous because they themselves acquire this thinking that their language and their culture is not as important as the English or the American culture. So as SLPs in 2023, we need to advocate a little better for these families and stop telling them that they have to pick a language.
Yeah, when I was working through these, because the next resource we have is, well, one of the other ones today we talk about is like sort of just like where would you even start with these clients if you're not familiar with them? Because there isn't a lot of support in our field. And like you're saying, it's just it's not morally okay to go about treating that way, treating families that way, or treating disorders that way. Because one of the biggest things that flagged across all the resources I was looking at is we're identifying children that are bilingual as having disorders, and maybe they don't. And then you're getting in a slippery slope where, like you were saying, Bailey, you're imposing like another culture on them and saying, well, you're disordered because you don't speak English well, or you're not white, or you don't fit in with wherever you live. And so I think that, in some ways, making these resources made me uncomfortable in the sense that I was like, this is not something I'm super familiar with, but I think that's what our field shies away from, is stepping into those and saying, let's try something, or let me at least start really thinking through this and combining these resources so it's accessible to our subscribers to start thinking, what should I do? Maybe I can't solve it all in one resource or one treatment session, but I can at least have a better, deeper understanding of where things are coming from and can build out to be a better support and advocate for these students and these kids. So I feel like, maybe my main takeaway from building these was like, I need to keep doing better. There are resources there. We just need to find a way to make them the norm and kind of swim against the tide that's been going of negative connotations for bilingualism, or over characterizing disorders, or not serving these families as well as we could, even if we are a monolingual therapist, like not letting that just be an excuse anymore to say, well, I don't speak that language, so I guess you're going to have to figure out mine. We'll go from there. So anyways, interesting stuff, but I agree. There's a lot more research lately and a lot more resources. So it's up to us to kind of use those.
Yeah, I think, you mentioned something, but I think academia is one of the places where we could start, because I know I have a lot of classmates or colleagues who said that their program made it mandatory that they took speech therapy themselves, either for accent or dialectal variation And many of them work program in mandatory for students in order for them to graduate as SLPs with masters in SLP. They have to take and they have to change of whatever region they are studying in. So we have to start, I mean, that's not the only place that we can start in. That's one of the main places that we should start in. It has to start with our programs that we are being educated through. Because what happens is, as SLPs who are bilingual, multilingual, who have dialectal variations, and even as those of us who are monolingual, and we're seeing this model from our academic program, and we in turn go and we do this to our patients and our clients. So that's one of the places that we can start.
You read my mind, Sonia. I was just going to say that. Like, I totally agree. You know, how are we training and educating students, grad students and clinicians, you know, from the start? I can't recall, maybe we had one discussion in our language development class about this, you know, about multilingualism. So yeah, that's absolutely a great starting place. Thank you guys for contributing your thoughts to that. Let's move on to our next resource. So Heidi, you wrote this one. This is titled Working with Bilingual Clients When You Only Speak English. So continuing this great discussion we're having, this is a 3-page resource with tons of just packed info in here, divided up into paragraphs and bullet points. Tell us more about where you were going with this one.
Well, this, kind of like you guys are saying, it's like, if I could take a class on this, these would be the 5 sections I would want to learn about more. So I try to give you guys like a brief overview, and like we collaborated a lot with a bilingual therapist that we looped in to make this even richer and more appropriate. So I'm just going to go through the sections because I think those are the most useful parts of this resource. And again, it's kind of just something you need to read it and then digest it and think, how can I implement this? Because I found myself, after putting this piece together, being a little more critical in my planning for my own, like my my work with patients, and thinking, okay, reminding myself that language learning is a system. It doesn't matter what language, we can still find ways to understand where deficits may or may not be. It doesn't have to be solely based on what language the child is using. So anyways, the first part, just like we sort of are talking, this is a thorny issue in our field. So there, we just have a little note on the ethics, and just mentioning it is a gray area to be a monolingual therapist giving services to a non-same language child. I mean, there's just inherently all kinds of pitfalls. And again, are you promoting one over the other? Things like that. So your best thing you should be doing is finding a bilingual therapist, which you can't always make them appear out of thin air, especially in different areas of the country. You're not going to find that. But that is the most ethical thing to do, is if you can't provide services in their native language or their home language, then you need to seek out someone who can. And that's being that advocate piece we're talking about. Again, if you can provide an interpreter service, that's kind of a nice middle of the road, not ideal. It's super awkward a lot of the times. It's not reliable. It's not available. But another option, you could, a professional translator, where it's either a service your facility has or something comparable. Really, the last thing you want to be doing is trying to get a sibling or a family member to be translating things. That just gets thorny because you don't know if they're, you can't assess everyone's proficiency in every language. And that's putting a lot on sometimes a child. I've had situations where, yes, that's like a teenager has come in and been like, well, I'm going to translate for my mom so she understands what you're doing with my sister. And, if that's really the only thing that there is, you can kind of plod through that for a little bit, but that shouldn't be your standing treatment model. But ultimately, if you're willing to put in the work and make an effort, it is okay. It's ethical to try. It's better to try to provide services than to, if you're comfortable, I guess would be the caveat there, than to just let a child languish and not have services if there's nothing else available. So we also then, like we were talking in the last little bit here, just the framework for bilingual child development. It doesn't cause a delay. There's language confusion. Actually, a lot of times if you find kids splicing languages together, that's showing an elevated understanding of both languages. So we shouldn't be critiquing that. If there is an identified language delay, you should still present both languages. You don't have to stop. You don't want to enforce that idea of picking a language. And again, if you were going to pick one to cut back on, it would probably need to be the second language. You want to support their home culture and where they're from, not say, well, okay, time to move to English because you live in America now. Like I hear that unfortunately more than I wish I did in all parts of my life. But and something that's just so beyond the ability a lot of times of a monolingual therapist, especially, to understand is there are dialectical differences in every language. So you really have to, if you can figure out maybe where the child is from and then get a little more information, maybe speak to a Spanish speaker or someone who's more familiar with the language, even if they're not part of your session, and sort of say, is there a dialectical difference going on? We have quite a variety of Afghan refugees in our community here, and there's quite a few dialects for their language, and it varies greatly. And sometimes we have trouble with interpretation services because they don't line up. So just being aware that we don't want to, again, assume that somebody doesn't understand what we're saying, or that even the interpreter is not understanding. We want to assume that maybe there are just too many differences still, just like there are in the US. People use different words in different parts of the country for different things. And something I found most useful was researching the native language phonology, kind of like we did with that Spanish phonological inventory, trying to understand a little bit from your perspective so you can know how to identify different phonological processes. So that kind of works if you perceive they have an articulation disorder. The assessment evaluation piece, there are a couple that are translated. We're kind of, again, in a narrow silo of Spanish, sorry. So the PLS comes in Spanish. There's a new one called the Bilingual English-Spanish Assessment. Again, those are designed with the right intent probably, but again, any standardized assessment, it doesn't matter where, who, what country, they are inherently biased in their creation. So, using words or scenarios that kids in different cultures may not have access to. It comes from a very white, English-centric model. So just being aware that you still have to have a critical eye, even if you're able to give an assessment in Spanish. We don't want to assume that there are deficits because there could be just a breakdown in, well, I've never been to that place, or that place doesn't exist in my world, or we don't use that kind of social situation. So using dynamic assessment is really one of the better ways to go about this, like teaching a child something. So first you test it, you kind of say whatever the stimuli is, trying to get them to say, request something. You try to teach them that in the session. And then you go back, you do something else, and you retest it and see if they can show the skill. So that's really hard, especially as a novice clinician, to kind of pull that off. But as you become more seasoned, you can sort of teach and retest these different stimuli that you're trying to understand, whether it's a language piece like expressive receptive, or it's an articulation. You want them to produce a sound. And then again, criterion-based assessments, where you're just kind of measuring the child, where you're starting with them and how they make progress, is probably a better route as well than relying heavily on standardized assessments for this group of students. And again, as much as you can, doing really thorough interviews so you can understand where these families and children are coming from. Where are the breakdowns? What can they describe? Are they having trouble understanding the child in the native language and their home language, or that's not really the issue? It's they're having trouble with English or whatever, trying to understand all the different pieces. I also came across when building this that I don't know if people are familiar with the school age language assessment measure, SALT, or SLAM, sorry, and then there's SALT as well. Those are platforms you can use and do a language sample, and they actually will translate into a couple different languages. So that could be helpful too, where you basically just record the child interacting with you and then it can do a language sample, and that could be super helpful when you're not totally familiar with the morphology and syntax of another language, but it would give you a starting point to understand. So there's actually, like we're saying, there is stuff out there. It's just not always easy to find or understand. So you have to take the time. Kind of speeding up here. Goal formulation. You can kind of use resources online, figure out what the phonemic inventories are if you're dealing with articulation, and find what error sounds or patterns that would align, and you could make that a goal. You want to make sure that the family can understand the goals. It's not useful if it just you only understand it, so being really cognizant of that. And again, making sure, even though it's going to be difficult, finding a way to understand how their communication is impacted at home, and that these goals align with things that they want, not things that we think they should be able to do. If that's not what the struggle is, it's not an appropriate goal at home. So I give some examples of each, and then for treatment, again, you can still use the same research-based treatment. You just have to find a way to either utilize, I think of like working with the maybe 2-year-old population, where you're trying to just teach simple requesting behavior or teaching vocabulary. You can learn that too in another language. That's why pictures are really great to have access to. And if you're able to do that research on your own outside of the session, to provide them, not that you're trying to provide the session in Spanish unethically, but you're trying to say, let me give you more familiar stimuli and words that you may recognize, so that I'm kind of teaching you the skill, and then the goal would be to teach the family at home how to engage in these activities. So anyways, I think the big thing here is you have to keep learning. I mean, I finished this resource and then I was like, there's so much more I want to add. I feel like I'm so behind in this area, but I think you have to kind of say, I've got to jump in and get some sort of framework to start from, and maybe that will be helpful. So that's kind of what this resource is trying to do. So.
Awesome, Heidi. Thank you. Go ahead, Tasanya.
Yeah, I really like this resource, Heidi, because I feel like there are way more monolingual SOPs than there are bilingual or multilingual, and we treat so many children, we encounter so many children who are bilingual or multilingual who need services, and like one of you have mentioned before, they either don't get it because some people just like, you know what, I'm not touching that. They're bilingual, I'm multilingual. I'm monolingual, or they try to work with these children, but the approach is just not right. So I think this is a nice step, and you had mentioned something about differences with dialect, and I think that's really important because, so for example, with like Spanish speaking patients, sometimes we'll get an interpreter, and that interpreter is supposed to be versed in knowing that there's going to be variations of dialect, but they are communicating with the family with Spanish that's from Spain, and these families are from Ecuador. Or, and there's so many differences in terminology that's used, and it still is a language barrier. Person to intervene, it's still not most optimal, but I think just keeping things like that in mind, and still always, and when you have someone who speaks the language, you still have to keep ethics in mind, and you still have to keep cultural variations in mind when you're working with these families. And also some facilities don't have someone that like a live interpreter, and they go for what's there. They have the virtual interpreters, which I think is amazing because it's always about trying to find someone to intervene who can help to make the intervention more robust or more effective. But we have to also keep in mind that there's a cognitive component, that the virtual is not always the best either. So I just want to say that it's okay sometimes to pull a family member in, or someone who's there, keeping HIPAA guidelines, of course, in mind, but just to have someone there a live person to help, because sometimes concepts are too abstract when there's a cognitive component that's there. So you might be doing your best to have a virtual interpreter there, but the individual still is not understanding, because first of all, you have to understand they're talking to a screen or listening to a speaker, a phone with someone who's talking to them. So there's a lot that's involved in that. So the point is that even in trying to be clinically, ethically sensitive, we still have to continue to do so as we bring in to the session all these other factors that we're using to try to help our patients or our clients or students. But I love this resource. I completely love it. And I would add it to, I give my interns a packet when they come in, and this is something I would give to my interns to use throughout their practice with me.
Sonia, oh, go
I
ahead.
was just saying, like, after putting this together, I mean, like, this took a while, because you're dealing with trying to capture a really big issue and like make one to two resources to start. But kind of like I said, my takeaways from it were we've got to try to do better. And then I almost didn't become as overwhelmed, because I was like, you know what, if I'm doing an early language session with a little kid, if I'm doing that in English, I'm not teaching 50 new words in this. Yeah, I mean, yes, you wish you could talk more in the other language, but it's like, it's not that hard for me to think about how could I just use colors in their native, go find and how to learn and listen on Google. I mean, you can type it in and it'll say it to you, or just simple requests, like how much more progress we could make if therapists were willing to kind of put themselves out there and try, asking questions like KS or different just short phrases. Like, it's not, we're teaching language, like I was saying, it's a system, it's a way to learn something. It's not a silo that's English. You only learn English this way. You learn every language in that way. So what things, kind of challenging myself to find what are the similarities of things I could do so that I can just learn a couple of things and get started somewhere. So just definitely a big area for growth for everybody, probably, in our whole field. And just, yeah, so.
That's so true. Like what you said about being an area of growth, and like what you were saying to Sonia, how you would, provide this to like students or interns, and maybe even like I had the idea of maybe like doing an in-service with other, like if there was like a bilingual or multilingual therapist at the facility, they could maybe use this as part of like an in-service or training, just to, have that discussion with the whole team, make sure everyone's on the same page, and just keeping everyone abreast of this, of this info. Awesome. I love it. All right, let's hop over to our next resource. Tasanya, you wrote this. This is called Pulmonary Conditions and Pediatric Swallowing Difficulties. This is a one-page resource. It has a paragraph at the top and then a chart at the bottom. So tell us more about this resource.
So how many of us as SLPs working with dysphagia of feeding have gone into, I'll say, the acute care setting more often, but not just acute, sometimes long-term care, outpatient settings. And we're consulted for complaints of swallowing difficulty, but there's no related diagnosis, is what we would hear from the referring physician or practitioner. Oh, well, the child's complaining, but there's no reason for it. There's no neurological reason. And then sometimes the chart review does not list a pulmonary condition, or sometimes it's there, but the practitioner doesn't think about how that may impact swallowing, or how that may be mirrored as a swallowing component. So this is what I was thinking about when I created it, because I know several times I've gone in and either encountered this, or I've spoken with colleagues who are like, well, it's really like a pulmonary condition. And with our adults, if it's COPD, people tend to think right away, okay, well, it's the COPD, it's not the, it's the chronic obstructive pulmonary disease, it's not the feeding, or they tend to problem solve a little differently with adults than they do with peds. So that's why I created this. So basically, this that contains 2 children And the focus was so
Did we lose you, Tasania? Oh no.
She'll hopefully come back. I know she said
there
there's
it is
bad.
now.
There she is.
Okay. Okay. So I'm going to backtrack a bit. I don't know what we missed. So this content, this piece has a little information on pulmonary conditions specific to the pediatric population. And even though I did focus a little bit more on asthma, it could be applied to other pulmonary conditions as well. And as SOPs that are trying to add to evidence-based practice, we should always be doing research anyway. So you would, when you're working with this population, you would always be doing research anyway to see how this applies. But this just lists some of the associated swallowing events that we may see with children who have a range of mild to severe asthma. And what I did was I provided the stage of the swallow and what impairment we will see, and then some of the characteristics and a little explanation. So for example, during the oral stage of swallow, we may see atypical movements of the tongue, and it might be through push strength, coordination, and control of the tongue with liquids and solids. And it takes place during oral bolus formation and bolus propulsion. And we see it with mild and severe cases of asthma, but more so with severe cases. As we do come across children in various settings, but very often in the acute setting, who present with breathing difficulties that are associated with their pulmonary condition, I created this piece. So I can tell you that I've sometimes went into to do an assessment with a child. And like I started mentioning before, the nurse might say, I don't know why they're complaining about pain, they're coughing with everything. And then when you do your case, your history, sometimes you as the SLP are the one who picked up on the asthma diagnosis. You know, they forget about it, or people don't realize the impact that the asthma could have on their swallowing function. Or sometimes their swallowing is fine and they're showing signs and symptoms of airway protection difficulties, such as coughing, throat clearing, and it's not anything to do with the swallowing function per se, but more so it is a characteristic of their asthma or their pulmonary disorder. So this is what this piece is all about. And I would say that SLPs can use it. I would share it with nurses. I share it with physicians. This is something that I give to whoever's in charge of the unit for education for the unit, and give to share this with them.
Yeah,
Go ahead, Heidi.
I love this because I was gonna say, as you were listening to people, I was like, I'm gonna give this to the doctors and the ICU, because the pediatric ICU I work in, because they just think everything is like it's just a breathing issue. There's nothing to do with swallowing, and you're like, it's all right there. Why wouldn't it? You know, and just having, or even pull the paper you're referencing in it to show them, like, actually it is very impactful. And you know, like you're saying, through the case history, sometimes it comes out like, oh, they've had pneumonia a whole bunch of times, random. And you're like, actually, it's probably not that random. Like, and you're like, here's why. Because I think this is, especially, I feel like asthma is, you know, the prevalence of it. We have a lot of admits here for asthma, you know, severe asthma attack. And just intubation for long periods of time. And the pulmonologists love us, but we can't always get to them through the attendings. We have to stay in our lane. And I'm like, I know the pulmonologist will love my opinion on this. So this is a good resource to use for that.
Yeah, super unique resource. And I love the chart at the bottom, just how you have it, like, it's just easy to read. and like if you have to quickly reference it, or if someone else of a different discipline's reading it, it's very like easily digestible, but like has really great detailed info in there. Thanks for that. Let's move on to the next resource. This is called Gliding Under the Ocean. It's an articulation activity. Heidi, you wrote this. This is like so like pleasant to look at. It's beautiful, beautiful colors, really engaging. It's 4 pages. It has instructions at the beginning with some bullet points, and then a nice scene with different ocean animals, and then some individual cards. So Heidi, tell us more about this resource.
Well, you guys have really been interested, it seems like, in more articulation resources, and we seem to do a really good job of making pretty ones that aren't antiquated looking. So, and glides are always a tough one. So this is an ocean theme. Yeah. So, and then I just give like 10 ideas of different activities you can use. So there's flashcards, you could match them. You could turn the lights off and do like an under the sea hunt kind of thing, where you could have them look at, you know, point the flashlight or pin light at one of the animals and say it. Yeah, matching again, or you could make a tongue twister with the words, or a scavenger hunt with the cards around the room. This is a great, like, please laminate and use for multiple people, because you probably kill your color printer if you did this 12 times, but a good one to just have in your file cabinet. You could do rhymes. That's something I find are really helpful for glides too, is like how you get two attempts for the price of one, kind of what rhymes with whale, and they could say snail and things like that. And then you can have them sort these cards by sound position to try and get building more of that phonological awareness. Like, where is the L sound? Is it the beginning or the middle or the end of the word? And put them in groups. Using a mirror when you're practicing these words. They could build their own story. And this also, you could probably find a way to do a teletherapy kind of activity with this if you're in the teletherapy world. So again, just an easy, very straightforward resource, really just making it to bring materials into the 21st century. I hate doing flashcards that are old and ugly or tattered. So these are really bright and shiny. And I also made this one, that whole submersible thing was going on. So it felt kind of like, oh, everything's in the ocean. So anyways, random thought. But yeah, lots of cute things. So easy to use. Print and go for sure.
I work with clients. Yeah.
I love it. And I like that you gave some sample activities that they can do with it. This is so gorgeous. And it's so funny, like you said, I won't say which one it was. I pulled an old deck of cards that I had, and I was like, oh my gosh, this is so outdated, so dull. And some of the pictures are so inappropriate. I love this. I absolutely love this.
I love that about our resources. Like, that kind of sets us apart. We just have really nice graphics and images. And I feel like a lot of the kids I worked with love ocean animals. It's just kind of a favorite, you know, among kids. Maybe not every kid, but definitely a popular one. So definitely lots of ways to use this. Love it. All right, let's hop over to our next one. This one is dynamic irregular past tense practice activities. I love anything with like grammar. Oh, I just love it. Heidi, you wrote this, and we have a couple of different pages. The first one we'll talk about has different, there's numbered instructions, and then we have some images and graphics. So tell us more about your thoughts here.
Well, like this month, the theme for me was what are things I'm not good at doing in therapy? So bilingual therapy is a growth area, and I cannot stand teaching irregular past tense because it's difficult, and it's like we've said, a lot of the resources around it are very boring or dull, and they don't move, and they're not really, you're just kind of hoping eventually the child memorizes what you're telling them, is kind of how I feel. So anyways, the first page here kind of goes through, it has 7 ideas to use these resources. So I was trying to think of a way to make something move a little bit more, and like, because I just have trouble with that temporal aspect of, for kids to understand what yesterday and today, and like, how do you get them to understand why, and switch and things. So there's these two frames. So what you would want to do is cut those out, the yesterday and today, and you can kind of move them over. There's two blank landscapes. I think we have these slides will like move here in a minute if you're watching online, but we'll wait a second. So things you can do. So having the child kind of just taking time to understand what past and present tense are. So moving yesterday, today, and like you could move them in more. There we go. Beautiful. Here it goes. And so then you see these, they're the same cards. They're the same picture for the present and past tense, and they have the word on them. And so again, it's still a little hard because like, how is the child going to know the difference other than spelling? But you're just going to have to, hopefully, you know, this is great for kids that can read. If they're still pre-literate, then you might have a few more struggles getting this concept through, but you'll have to rely more on the auditory cues. And then sort. So sorting is always a good activity, matching pairs together. And then drawing 3 cards from the same tense and making up a story, and then trying to get them to tell the story in past tense. And again, using these frames to kind of help them have something to do kinesthetically, like, okay, I'm going to move these down here. Look, makes, made. So yesterday I made the, what is he doing? He's painting. Yesterday I made a painting activity. Today, or he's makes one. So again, even as I'm stumbling over my words because it's just such an awkward thing to teach, but I felt like giving some more visuals and cutouts and things to move around would at least give you more flexibility versus just like, here's a worksheet, fill this in. You've got to understand that makes goes to made, or speaks goes to spoke, things like that. Something I found works really well is saying it wrong, trying to get your client to say the wrong thing. Like when they're starting to master it, be like, okay, say that backwards, or say that for today, even though it happened yesterday, or, you know, happened yesterday. And then you could also make a little Mad Libs. So again, trying to find, you know, I don't even think I have all the right ideas for how to use these cards and these sort of frames and landscapes, but because it's more mobile and you can just cut them all up and have the different scenes, you can move things around in a different way to maybe give some more depth to the activity, or help those people with, you know, kids that need more visual supports for this, or the moving piece, or the temporal understanding. So again, it's a difficult one. So at least you'll have some cards and some different literally frames of reference to understand the 2 tenses. So maybe it'll help.
Yeah, I'm always looking for different ways on how to address this particular just abstract part of our language. I love it. I love how, you know, there's just like different ways to use it. And like, again, the images are like super engaging, good conversation pieces, and even like going past, you know, we could make even more sentences or a few different sentences depending on the child's functional level. Yeah, this is fantastic.
I think it was a good idea to use the same images as well. I think it will help to carry over the concept. You know, irregular past tense is one of those topics that I put into the basket with our difficult areas, like with R, for example, you know, that's articulation. But that goes into that basket. And I think that this helps. This helps a lot. This would help a lot.
Yeah, I went back and forth on having the pictures be the same, but then I was like, they have to be the same because that's what kids aren't under. Nothing is different except the word that you use. So I'm glad to hear that support. That was a good choice, because I was like, should they be like one have a different background color or something like that? So you could do that as well. Put like a little star in the corner of all the past tense if you wanted to help them identify. But again, you're sort of just trying to make a really abstract concept concrete, and that's always hard. So.
All right, y'all, let's move on to the case study. So I'll go ahead and read it, and then we'll talk about it and our resources that we chose. So the case study for this month, and just before I start, we always like to do a case study because it allows us to just talk about potential cases in different ways. We all give our perspectives. And also we like to tell you about some of the other resources in our archives that relate to the case study that you could use. So we have a 6-year-old female who has a diagnosis of childhood apraxia of speech. She has been in speech therapy 2 times a week for the past year. She recently changed schools, going from kindergarten to 1st grade, which her parents report has caused an increase in challenging behaviors at home. Her speech pathologist also feels her progress in therapy has been affected by this life change, as she is difficult to engage and often refuses to participate. Her parents are wondering if she could either take a break from therapy or increase therapy sessions while she is adjusting to this change. So we all chose some different resources from our archives, and the one on the screen now is something I chose. So this is a 1-page resource. It's a really nice, simple activity. It's spring-themed apraxia activity, and we call it the speech garden. So this has some CVVC, different syllable shapes with pictures of flowers. Some examples are me, my, be, bo, pie, etc. And it has some instructions at the top, and the child can place the flowers in the picture in whatever way they want to by practicing each syllable shape or word. And then again, depending on, so this child, for example, might be past, those smaller syllable shapes. So putting those into sentences, because we know practicing connected speech is so important with apraxia, and just using those words in different ways. You could do it at the word level, phrase level, sentence level, connected speech. So it's a nice way to practice those different shapes depending on where the child is, and then incorporating them into where their current level is. All right, let's move on to the next resource. I believe, Tasanya, you chose this one. So it's a 1-page resource called Therapy Techniques and Activities for Childhood Apraxia of Speech Without a Certification. So go ahead and tell us why you chose this resource.
So I just want to say that the family is requesting to either take a break or to increase. That's a big, it's very like cloudy. I mean, it's very confusing. You either take a break or I chose this family could also try to be involved in doing some therapeutic stuff in the home setting. So it discusses what CAS characteristics are and some of the guiding principles, how to develop a treatment plan, motivating principles, tackling dysprosody, incorporating phonological awareness, and also a little bit about certifications and childhood apraxia speech. And even though this would be more so for as a clinician, I always think that the most therapy is done, or the greatest therapy is done at home. So I would share this with the family, and I would share this one with the family so they have an idea of what they can do with some goal planning at home. You can go to the next one. So this one talks about speaking rate and pacing, and there's some ideas on how children with articulation errors and phonological processes and speech delays, practice of speech, how they generally benefit from speech pacing. Like I need to speech pace right now. So there's some ideas on what the family can do at home. And again, I chose this because it's some stuff that the family can do at home to carry over since they're requesting possibly increasing therapy. And it's a high chance that they probably would not get increased therapy, or that's a possibility that they may not get the increased therapy. So I chose this so they can work at home with their child on it, or so they can share it with their treating therapist, and also so that they can have something that's fun to try to help keep her engaged, him or her engaged in the activity. Next.
Move on to the next one.
I think it's interesting, like you brought up, that a parent wants either more or less therapy. It's like I find that frequently we're trying to figure out like what the breakdown is. Like, is it sometimes kids are overdone and they do need a break. So one of the clinics I've worked in, we would cycle kids. They could only come for 3 months for like 12 sessions, and then they would have to take a month off, and then we would revisit it just to see if some natural generalization could kind of occur. So that was an interest, especially with CAS, which can be a really frustrating diagnosis. Sometimes you don't always feel like you're making leaps and bounds every week, but maybe a break is helpful. So
I agree. And I was going to say too, Tselani, you were talking about how like this case study, the parents are kind of like giving us mixed signals here. Like, do we want to stop therapy, or do we want to, increase it? What's the best call? And that's tough, and I think with Apraxia and with her only being in therapy for a year, I would not recommend stopping therapy. I know she's had this major life change, so maybe, I don't know, reducing to once a week or something. But I know we all kind of have different opinions about that. I mean, what would y'all do? Would you recommend to the parents, okay, let's take a break for a couple of weeks until she gets readjusted to this change and these behaviors reduce? How can we help with the behaviors, or do we keep going?
I think I end up having a lot of like tough is not the word, but like deeper conversations with the family in these situations where, are we coming to a place where maybe we need to accept that this isn't something that's gonna like go from nothing to, from having this language disorder to, or this motor speech disorder, to not having it at all. And sort of, it reminds me sort of some of my stuttering training, where you talk about the iceberg, where, okay, on the surface, we have what we can fix, but the reason all this is happening is not just related to how they're speaking. So like, sometimes I talk to families about like, what other supports are you getting? Are you receiving, maybe she would want to go to a different type of therapy or a counselor to adjust to this change. Not that that's always our role to say that specifically, but sort of having that conversation of like, is speech therapy what really the only thing here that we're up against? And only if you have a good relationship with the family would you have that conversation, but rarely, would you get to this point, I don't think, without some sort of relationship to have those conversations.
Definitely, especially if you're that far into it. Okay, our resources back up to Sonia. You chose this one for the case study, the no prep dice game for Apraxia. Super fun game. Tell us more about why you chose this one.
Again, because it's a fun game, and the family mentioned that she's often difficult to gauge and refuses to participate. And let's be real, sometimes because the activities are boring, or because they're very repetitive, or they seem like an exercise. So why not look for something that can be fun, or that can make it a little bit more exciting, help to make the child look forward to the sessions. And again, it's something that can be done at home. So this piece includes some CV words, VC words, and CVC words, CVCV words, CVCV, and two-syllable words. And I think it's just a good activity that the family can carry over at home. I'm really big on carrying over therapy at home, especially for something like apraxia speech, because sometimes people just think there's going to be like an overnight change. And I think one of the reasons why, which is why I mentioned that first piece that I just mentioned 2 pieces back, sometimes a family just has to understand that it's not going to be something that will disappear after a year, or something that will be addressed after 6 months. So I think these activities are great for carryover at home, and they would be a good option to help keep their child motivated and engaged in the session.
Fantastic. Thanks for choosing those. Let's move on to Heidi's resources. Heidi, you chose this one. It's called Ice Cream Syllables. So cute. 3 pages, and it has little ice cream scoops with different shapes, and then some images at the end with ice cream cones. So tell us why you chose this one.
Same kind of as the dice game. It's just fun. I think sometimes if a kid's been in therapy that much, it is repetitive and boring, and we're not magicians. I mean, we can't always like make up a new game every week, but if you haven't used this one, and most kids love ice cream, I don't know why, and cones. So you would cut them out and you make the different words. And it really helps too with phonological awareness as well. And I don't want to say spelling, but sort of reading and eliciting and blending words. So you could even also have them make silly words too, because again, with apraxia of speech, you're really just working on the production of the sound at that point. So just another fun, cute activity that you might get a little more buy-in from this little girl.
Love it. And you chose this one, 2-page resource called Toys and Games to Complement Speech Therapy Sessions. So tell us more about why you chose this resource.
Again, sometimes we just need ideas of things to do. We don't have time to create something brand new every session, especially if you're seeing somebody this frequently. So these are just common games we list that a lot of schools or therapy departments would have. And it goes through the different, it kind of tells you which area you could focus on, like voice resonance, articulation, phonology, receptive, expressive, or cognitive linguistic. But really, I think any game you could sort of tailor to what you needed if you were creative. So, and I'm not a big board game person like in my own life. So sometimes I don't know all the stuff out there. So I was like, oh, these are cool games. I should grab one of those. And you could just grab it off the shelf and use it. And again, similar to teaching the family, like maybe having the parents come in for a session and be like, look, we're going to play Monopoly. Here's how I would make this an articulation type of activity or game so that they could learn a skill to practice it in a non-confrontational, non-therapeutic environment. So
I like that, Heidi, a lot because, like a lot of times you see comments made like, oh, you're just playing a game. Like, what are you working on? You're just playing. Like, we're just paying you to play a game with my kid that I could do at home. So you're like showing them which areas of development and skill areas that you're working on, and then how they can do it at home, like you said, without, overloading them with like super scientific, words, and just kind of an easy to do activity that's, functional and realistic for them. I think that was all the resources we chose for the case study. So I think we're going to wrap up, everybody. Thank you again so much for listening in and watching in. We want to thank all of you therapists for just continuing to be keeping therapy informative, empowering, and person-centered. And then you see the bullet points on the screen, just some more info for you. And then we want to also say this is our last episode of the Resource Roadmap Show. So thank you so much for watching.